The story of Stephanie Miner and her battle with breast cancer is something that really inspires each of our breast imagers. We have a number of fellowship-trained, subspecialty trained breast imagers that come down to provide services to this community, and each of us has had a chance to understand and learn more about Stephanie Miner's battle with cancer, and that really inspires us to improve in many different ways. And the progress our center has made this year for all women in the San Luis Valley has been amazing. Earlier this year, thanks in no small part to our director, Janet McGinnis, who I want to make sure to name, we were able to acquire and install a new tomosynthesis unit. Tomosynthesis is 3D mammography, and it's an advance in the field of breast cancer screening that really has brought the ability to improve detection of breast cancer. We can see these cancers and potential cancers about 40% earlier, and we can see more cancers than we could see before when we're seeing these images as opposed to a regular 2D mammogram. Reading for a radiologist in my field, reading a 2D mammogram has been compared to reading a book with clear pages. You can see that there are words there, but they're all superimposed and they overlap, and it makes it difficult to understand what the words are saying. With 3D mammography, it enables us to actually open that book and look at the pages individually to see each of the different levels of the breast to help us understand kind of better what's going on in the breast. This machine, combined with the knowledge and skills of our mammographer, Barbara Carlson, who's also here today, I'd like to thank her for her help, will enable our group of radiologists to detect, as I mentioned, up to 40% more breast cancer compared with 2D mammography alone, and we'll be able to detect them earlier, as I mentioned. It also helps us more effectively screen women with dense breast tissue. As you may have noticed, Colorado passed a law in 2017 that requires that we notify all women of their breast density. If you get that letter and it says that you have dense breasts, tomosynthesis is really going to be helpful for you, and it's something you should really think about. Another exciting development that I'd like to talk about just briefly and share with you that has been made just recently. In fact, I found out about this a couple weeks ago. Again, due in no small part to the work of Janet McGinnis and our administrative team here. Soon, at about the end of November of this year, we will be able to perform what are called stereotactic guided biopsies of the breast here in the Valley. These are breast biopsies that we used to have to send out to Pueblo or Colorado Springs. Women had to travel 3 hours each way to get this very necessary diagnostic procedure done, but now we'll be able to do them here with our crack team of radiologists and our technologists in the department. So we're very excited to be able to enable our center to be able to perform these biopsies. And it's another big win in our fight against breast cancer. I do want to thank everybody here today for helping us at our booth today. If you haven't had a chance to visit our swag tent, make sure you go over and help us out there. All the proceeds will go to our foundation to benefit the Breast Center. I also want to thank each and every one of you here today participating in this event. Your kindness and generosity and the dedication to this cause and to our program are essential in maintaining and elevating the quality of breast care that we can provide to women in the San Luis Valley and the surrounding communities. Just a couple of final thoughts. As we approach October, which of course is Breast Cancer Awareness Month, let us remember that breast cancer is the most common cancer that affects women, and the second most common cause of cancer-related death in women. Approximately 1 in 7 women in Colorado will develop breast cancer at some point during their lifetime. That's higher than the national statistic of 1 in 8. So it's common. I'm sure there are women here today that have been affected by breast cancer either personally or know somebody that has been affected by breast cancer. It's that common. Please remember, the best chance at a cure is early diagnosis. If we can find these cancers when they're small, we can treat them much more effectively, and tomosynthesis will enable us to do that. This means beginning annual screening when you're age 40, and there is some confusion about that, but We can save the most lives if women undergo screening mammography once a year beginning at age 40 if you're at average risk. Now, if you have elevated risk factors, if you have family history of breast cancer or other genetic factors that might increase your risk of developing breast cancer, please talk to your doctor about getting screened, but also the possibility of supplemental screening, which may include ultrasound or MRI of the breasts, to help detect those cancers early. Again, I want to thank everybody for coming out today. I'm very honored to be here. I thank you all. Again, early diagnosis is our best chance for cure. I thank you all for having me. I'm going to turn it back over to Kelly.